Welcome to the Black Birth Stories podcast. I'm your host, Dr. Tiffany Woodus. I'm a wife, a mama, board-certified OBGYN, and I'm here to help you take back control of your birth story without the fear of becoming a victim of the Black maternal health crisis. Today's episode is a reaction video. Let's get right into it.
I'm going to be telling you guys my birth story. I have my phone because I have it down to the detail, down to everything that went down. I'm not going to remember off the top of my head, so I wrote everything down, and I've never had a fear of childbirth itself. I will say pregnancy for me was miserable, absolutely horrible, throwing up every day, multiple times a day.
You know, I'm so glad that she addresses how, pregnancy was not all roses and sunshine for her every day. I think that we need to have more real conversations like this because there is not a monolithic experience that everyone should have, nor should we make people feel bad because they don't reflect back on their pregnancy and, love every moment of it. It actually can be pretty miserable for some people. Some people do have conditions and concerns during their pregnancy, things like hyperemesis, where they have intractable, as in uncontrollable nausea, vomiting for extended durations during their pregnancy, not just the first trimester and certainly not just in the morning, where they physically are ill every single day. And the misery and the discomfort that goes along with that can definitely make this less than an enjoyable experience. And it's okay to say that out loud. It's okay to normalize these conversations and just admit that, gosh, it wasn't fun. I don't miss that part of the experience, but goodness, I'm so thankful that she was open and honest. And I would just hope that more people would feel comfortable saying what it is and being truthful and honest about what they truly experienced during their pregnancy journey.
So I ended up going a day past my due date, which was the longest day of my life. I literally cried, I prayed, and I was like, Lord, please do not let me go over like a week, 2 weeks. I've heard women go like 41 plus weeks, and I'm just like, I can't do it. Pregnancy was so miserable for me. Like, I just wasn't expecting it to be that bad. I feel like no one ever warned me. Like, I've only seen like cute pictures and stuff, so I didn't want to go any longer than I had to, but I gave birth at 40 weeks in one day, so it was only one day, but it was the longest day of my life.
So it's important for us to remember that the due date is just an educated guess. And it depends on a whole lot of things. So it depends on you for sure knowing the first day of your last menstrual period. And then even before that, it depends on you having a regular monthly cycle so that we can rely on the first day of that last menstrual period. So that's the first thing. Then generally you want to present for pregnancy typically between 6 and 8 weeks. So just past having missed that first cycle. And at that time, an early ultrasound is typically done. We call it a confirmation of pregnancy ultrasound in my practice. But essentially, we're, yes, indeed, confirming that you are pregnant, that the pregnancy appears to be growing and developing normally. And we're also taking some measurements to make sure that the pregnancy is measuring consistent with how far along we think you are based on the first day of that last menstrual period. So that's how generally your due date is calculated. So it's a sure first day of your last menstrual period, consistent within 7 days of the ultrasound measurement. And if we get that information, we feel pretty certain that plus or minus 7 days is your due date. So that's how that number comes about. That due date is calculated. Once we hit about 37 weeks, most folks are over it. There are very few moms that come in that are still smiling at me, that are still kikiing and laughing and having a good time. Most people are way past over it, especially if it happens to be the summertime in Texas. Like, ooh, it's a tough crowd. Like, seriously, most people are way past over it, especially if they go past their due date. I mean, you're just so big and uncomfortable and usually can't sleep, hadn't slept in weeks and weeks and weeks. Baby is smashing your bladder to pieces. Your body is aching. Your pelvis is spreading. You're probably retaining fluid, heartburn, all the things. It can be pretty miserable. Most folks are over it.
Every time I go to the bathroom, I was looking for labor signs like mucus plug or bloody show or anything. And I was doing curb walking, tea, dates, pineapple, like all of the hacks and tricks to like soften your cervix and like prepare. I don't think it worked. I wasn't early, but do whatever you want to do. I was basically like ready to go.
So the pregnancy hacks that she is bringing up, I don't have any good evidence to suggest that they accelerate the labor process. I do recommend curve walking to my patients, and then other stretches and exercises that will help to open the pelvis and prepare a woman's body for labor. In terms of dates and teas and that type of thing, patients will often ask me about those things. And what I tell them is that this is kind of a gray area. So what that means is I can find a group of research that says, yes, perhaps there might be some validity to these things, but the evidence is kind of loose. It's not good data. And then I have a group of research papers that suggest that probably it does not. So what I tell people is, use good sense. Don't do anything that's going to be dangerous. Don't do anything that's going to be harmful. Because these things are unlikely to be harmful, then I'm okay with you trying them 37 weeks and beyond. But don't hang your hat on them.
And for context, I did have a labor scare at 34 weeks. I ended up being okay, but that made the rest of the pregnancy feel so much longer because I was like, oh, I'm gonna be so early. Like, I almost gave birth at 34 weeks. Surely I'm gonna be early. No, I was late. So July 24th at like midnight, I couldn't sleep. So I went downstairs to watch Grey's Anatomy. I was on a Grey's Anatomy binge and I ended up falling asleep. And I woke up at 2 a.m. with shooting cramps, like shooting sharp pain, but I thought it was a dream. Like, I thought I was in surgery because I was watching Grey's Anatomy, so I literally thought I was having like an operation performed on my stomach. That's really dramatic, but that's what I thought. So I didn't get up immediately because I was like, oh, this is a dream, it's not real. Well, then I was like, okay, wait, this might be like labor, and my water didn't break, but I was having those strong cramps. And I'd never experienced that kind of discomfort before. It wasn't like pain yet, but it just felt like, they say that you'll know, and I hate to tell you, but yeah, you will just know. You will know. It feels different. It is kind of like a period cramp, but stronger. Like, that's the best explanation that I have.
So she's referring to Braxton Hicks contractions or false labor contractions, and this is your body's way of prepping and priming you for labor. I say that they are a necessary evil. We welcome them. They don't feel good, but they are doing good things for us, especially with first-time moms. It takes our bodies weeks and weeks and weeks to get ready for that finish line for labor. And these Braxton Hicks contractions are taking us slowly but surely through this process of getting ready. So what they are doing is they are softening our cervix. Our cervix is super firm at the beginning of pregnancy. Think like your nose. It's floppy like a wet pancake when it's time for labor. It is taking that cervix from a posterior position behind baby's head to a mid-anterior position, which is more of a labor position. It's also starting to dilate the cervix and shorten or efface the cervix. What that means is typically in the beginning of pregnancy, our cervix is 4 to even 5-6 centimeters in length, and it goes from that length to paper thin at time of delivery, and it takes weeks and weeks and weeks for our body to go through that transition. And so some people will say that these contractions feel like menstrual cramps. Other people will say it's just like a tightening or a hardness to the tummy, like if my hands were big enough to squeeze, hold, release. Some people just have discomfort in their back. Any of those things would qualify as false labor or Braxton Hicks contractions. And most first-time mamas, will contract, I usually tell people, pretty consistently for several days before it's time to come in for labor. Braxton Hicks contractions are irregular all over the place. There's no rhyme or reason to them. You might have a run in the morning, then they peter out. You might have a run in the evening, then they peter out. If you've had a busier day, you've been on your feet, on the go, you might have more frequent contractions. If you are dehydrated, so it's the summertime, all of us are behind in our hydration in the summertime. Your uterus is a big muscle and gets crampy and angry when it's dry, so you'll likely have more contractions. When you are dehydrated or dry, or when your bladder is full, remember your bladder is attached to the front lower part of your uterus, that can also make you pretty crampy as well. If you feel like you're having more frequent contractions, I would recommend that you empty your bladder. Sit down, put your feet up and rest. Hydrate yourself like crazy, taking as many fluids as you can stand. Water is the best thing, but it doesn't just have to be water. If it's convenient, you can get in the bathtub, or you could use a heating pad, warm compress. You can do 2 extra strength Tylenol and just watch. Labor contractions are usually regular rhythmic contractions where you can look at the clock and go, oh yeah, they were every 10 minutes. Now they're every 7 minutes. Now they're every 5 minutes. They're lasting longer, getting stronger, not going away. Labor contractions are usually consistent contractions that are at least every 2 to 3 minutes, lasting at least a minute for more than an
So I
hour.
started timing them, and they were every 5 minutes for 1 minute, and I knew that meant it was time to go in. I waited for like an hour just to make sure.
She's talking about the 511 rule, which is often a rule that is cited to help you understand when it might be time for you to go in for a labor evaluation. So if you feel that you're experiencing contractions that are at least every 5 minutes, lasting at least a minute for an hour, I would try all of those interventions that I just mentioned. And if that continues for more than a couple of hours, I probably would let your OB or your midwife know and get their opinion about whether or not it's time for you to come in to be assessed.
You just want to give birth, like you're over it. So I was like, let me just make sure that these are consistent. And I had been having consistent Braxton Hicks for weeks. So I was like, maybe these are just Braxton Hicks, but a little bit stronger. I don't know. Well, then I was like, okay, I think these are real. So I went upstairs and I woke up my husband at 3 in the morning and I was like, babe, I think it's time. And honestly, he was way more nervous than me. I think I was just thinking like, oh my gosh, I'm not gonna be pregnant anymore. Like that's literally what I was thinking about. But he was so nervous. He jumped out of the bed, he got the bags ready, which our hospital bags were packed, but there was just a few things like toiletries and stuff like that.
I tell all of my patients around 37 weeks that their homework is to get their labor bag ready. Typically what you need is just what you would need if you were going away for a weekend. And if there's anything special, you definitely want to bring that as well. So we have all the things in the hospital that you need for your baby: diapers, wipes, onesies, burp cloths, all the things. So you typically don't have to bring any of those things. But if there is a special first this or first that outfit, going home from the hospital outfit, picture taking outfit, you definitely want to bring that with you. And you definitely want to have that prepared so that if you needed to grab it in an emergency or in a hurry, or if someone needed to grab it for you, it's just a matter of picking up and going. Maybe just add some toiletries and then you can be on your way. But I think this is a good activity for around 37 weeks.
Honestly, it was the Lord. Like, I loved the hospital that we gave birth at. Like, it was the best, and I plan on going back to that hospital because I loved it so much. But every time I tell a mom that the hospital is 45 minutes away, she would look at me like I was crazy, which I don't even know why that's a question of like, where are you giving birth? Like, a hospital, okay? Like, I don't know. So when I'd have to say I was 45 minutes away, they'd be like, okay. So yeah, we drove 45 minutes.
I want us to be very intentional about our birthing facility because it matters, especially when it comes to Black maternal health. It matters. We need to be just as intentional about choosing and paying attention to the birthing facility as we do our birth provider, because your physician, your midwife is just one person, and that one person operates within a system. And honestly, all of us are only as good as a system that we function and that we operate in. So you need to tour your birth facility. You need to tour your hospital. You need to tour your birth center, and you need to ask questions. For example, if it's a birth center, how do you respond and react? What is your emergency plan? What happens if there is a need for transfer to a hospital? Do you have a physician backup? At that hospital, is there a physician sitting in this hospital 24/7, an OB-GYN, board certified, who is equipped to step in the event of an emergency and can respond and react immediately? What are your C-section rates? Do you have safety bundles for things like hypertension, postpartum hemorrhage? All of the things that we are used to hearing about when it comes to the number one concerns for Black maternal mortality. Is there a outlet for me to express a concern or a grievance should one come up? These are all very, very, very important questions. In regards to the distance that she lived away from her birthing center, I think that 45 minutes it's a lot, but I don't think that it is undoable if, like she said, she loved the facility and likely had a very good relationship and loved the provider that she was paired with at that facility. I think that there are very few instances where there is a true emergency where, you would not have time to safely get yourself, even if you needed to the hospital. If you are leaking, just put a pad on and drive yourself safely without harming yourself or anyone else to the hospital. I think that 45 minutes is a lot, but I think that it is doable, especially if it was the situation and the setting that she felt the most comfortable in. But at the end of the day, it is important. It matters. Be intentional about not only your provider, but the birthing facility. What are the outcomes for your birthing facility in terms of maternal mortality and morbidity? Readmissions for things like preeclampsia, postpartum hemorrhage, transfusion rates, all of that type of thing. All of these questions are very important and could literally, for us, for mamas who look like me, be the difference between life and death.
These are the worst mistakes Black women can make when choosing an OBGYN, assuming they'll automatically prioritize your safety, ignoring the signs when they dismiss your concerns, and not having a plan to advocate for yourself. Sis, I've been there, and that's why I'm so glad I found the Mocha Maternity Survival Guide, Choosing the Right OBGYN. This guide gave me everything I needed to avoid those mistakes, from conversation starters to tools for assessing their care. It's the ultimate roadmap to make sure you're seen, heard, and protected. Don't take chances with your health. Get your copy today and make the choice that could change everything.
But honestly, it was the Lord because there was no traffic and the hospital was completely dead. Like, well, not dead, but you know what I mean? Nobody was there. And so it was just, I knew it was the Lord, you know? So the whole drive there, my contractions were still every 5 minutes for a minute long. Zach was able to kind of like time them. And when we got to the hospital, he was like, yeah, they're definitely every 5 minutes for a minute long. So I was like, okay, good. They should take me. Like, I should get admitted quickly. You know, that's what I was thinking. No. So we went through security at the emergency room because the main entrance to the hospital was closed. And the security guy, like, he made a joke. He was like, man, there's a lot of people giving birth tonight, you know? And I'm just sitting there like in my pajamas. Well, not my pajamas. I kind of like changed in my crusty outfit. I didn't look cute. And I was like, haha, like mid contraction, like, yeah, I'm one of them, And this was honestly like so embarrassing. So right in front of me was a woman giving birth, but she looked so cute. She had like a matching set on. She had cute little matching bags for her and her husband. She was scheduled for an induction. Like she told the lady at the front desk that, and I'm getting rolled in a wheelchair in my crusty outfit and my bun, and I am having a contraction and I just look miserable. And I'm just like, this lady is probably so happy that this is not her. And then Zach had to get checked in and the lady just whisked me away on the wheelchair. Like, I'm just like, where did my husband just go? It doesn't sound as chaotic as I'm making it sound. It was really peaceful. Like there really was no one there. And I remember the lady pushing me so fast because the breeze just felt really nice. But she was like, okay, you guys are giving birth, come with me. The lady getting an induction and her husband and me and the lady pushing me in the wheelchair are all in this elevator together. I'm sitting in the wheelchair, like holding my stomach, like I look crazy. And then the couple next to me, they just look so cute. And I'm just like, I wanted to be like, hey, how are you guys? But I was having a contraction.
Look, they look cute for now. Homegirl does not know what's about to hit her, but enjoy the moment, dear.
But I will say, I am kind of like not for elective inductions. Not that that's what she was getting, but they offered me an induction at 39 weeks and it was just to like get it over with kind of. And I was like, no, like I feel like my body will know what to do when it's time. Don't get me wrong, if there is a reason that you need an induction, like 100%, I'm not gonna be like, oh, that's so, whatever. But to get an induction just to like get the pregnancy over with, I just feel like I don't want to like push my baby out when he's not ready. Like he'll know when he needs to come, and it just was the perfect timing. And the crazy part is there were like 3 inductions scheduled that night, and I was the only one there that was just like labor started and whatever. I was the first one. Not that there's like a reward or anything, but I feel like the midwife came in and she was like, you're the first mom to give birth on this floor, yada yada, of the day, and she's like, there were scheduled inductions and they're like still pushing like, you killed it for a first time mom, all this stuff. And I just feel like your body will know when it's ready. And don't get me wrong, I'm pro medicine because like I got the epidural. Like I am not a natural queen, I'm just not. But when it comes to like medically inducing the labor electively, like I'm just kind of like, I don't know, I feel like my body will know what to do.
Let's talk about elective inductions. So this is a hot topic. Elective inductions, according to the American College of Obstetrics and Gynecology, which is the governing body for board-certified OB-GYNs, are considered to be appropriate after 39 weeks without a medical indication. Elective induction, that is hence the definition of an elective induction. I personally do not like elective inductions, particularly on first-time mamas, because I often think that we do not do a good job communicating the expectations that go along with this process, because it is a very long, tedious, drawn-out process, usually for most first-time moms. I'm talking about a process that likely will take 2 to 3 days to get us to the finish line. And so, if you do not go into this process with correct expectations, you will leave the other side of this process and be disappointed, underwhelmed. You need to understand that going into this process means that likely you will require every intervention in the book, right? Because we are trying to fast track and coax and force your body to go into labor. where it might not spontaneously be ready for that. And that takes quite a bit. They don't just fall out. It takes quite a bit of work. There is a reason that we call this labor. So if this is something that you are considering, you need to have a very candid conversation with your OB provider about what this will realistically look like for you, because more than half the battle is going into this process with the correct expectations. Understanding what this will look like, what is involved, what the time frame might look like when you are making a decision for or against going through this process. So there are lots of things that we look at as OB-GYNs, as OB providers, about whether or not someone is a good candidate for an induction. I'm looking at things like how many babies has this person had? What does their cervical exam feel like? Are they considered favorable, meaning their body has already gone through these Braxton Hicks contractions and their cervix is soft, it's anterior or mid position, it is starting to efface or shorten, and that process of dilation is happening. Likely that person will respond and react more favorably to an induction, and it will be less arduous and drawn out for that mama. Let's go into medical inductions. Now, there are lots of reasons why someone might need to look at and consider a medical induction. So these are conditions where if the pregnancy is maintained, there might be harm to the developing fetus. So for example, poorly controlled high blood pressure, gestational diabetes where the blood sugars are poorly controlled. These are conditions that might cause harm to the mama and harm to the baby if the pregnancy is maintained. And often at term, there is not good reason to continue the pregnancy if you are seeing persistent or worsening conditions that fall under this category. So these are medical inductions. An induction for a medical reason because there has now been a concern, a potential morbidity associated with this pregnancy. So that is an entirely different thing. In either case, a very thorough, open, honest conversation needs to be had with the patient and the provider so that you understand what the process is about, why it's being recommended, or if it's elective, why you'd like to consider it, and what realistically you're looking at as you go into that process.
So I don't know what triage is, but I think that's where we were because they put me in this room. They couldn't check me in. They had to make sure that I was actually in labor since I didn't have my water break or anything.
Triage is often your first stop when it comes to labor and delivery. Triage is essentially just that. It's where the provider or the nurse tries to figure out what exactly is going on. Is this a concern that can just be dealt with in the triage area and then the patient able to go home, or is this something that needs to be brought into the hospital for further observation or management? And so oftentimes triage literally means we are trying to assess the situation and prioritize the situation and then figure out a disposition for the patient.
I got settled in that room around 4:30 in the morning, and Zach came up, he found me, and they performed a cervical check, which those are so painful. I hate them. And I was only 2 centimeters dilated, which I had been 2 centimeters dilated since 34 weeks. I could have sworn I would have been a 3 or a 4 because of how consistent the contractions were. I was surely these things are doing their job. No, I was still at 2 centimeters. And at that point, she was like, okay, you guys can go home or you can walk around the hospital for a few hours and see if that'll help progress the dilation. My heart fell. Honestly, that felt like both of those options sounded horrible to me. I was like, the last thing I want to do is walk around this hospital looking crazy, having contractions. I was like, I don't want to do that. But I also didn't want to go home because I knew in my gut that this was the night baby boy was going to arrive.
It's pretty typical for first-time moms to walk around at half a centimeter, 1-2 centimeters for weeks and weeks and weeks and weeks and weeks. Things do not happen very fast with first-time mamas. And so I definitely understand her disappointment here. Again, her body was getting ready for labor, but it wasn't quite time yet. We often call that prodromal labor, where you're having more consistent Braxton Hicks contractions, kind of moving into a more active phase, but your body is still really kind of prepping and priming and not 100% there yet.
So she gave us time to think about it, and I'm just like, babe, I don't want to go home. I don't want to give birth in the car. I just don't want to do that. So she came back and asked us what we were going to do, and she kind of clarified that when she said walk around for a couple hours, she meant the labor and delivery unit, which changed the game for me because I was like, oh, wait, yeah, I could totally do that. It was really peaceful in there. So I was like, okay, I'll walk around for a couple of hours, see if I can get things to progress. But I was terrified because I was having contractions, and they were strong and they were painful, and I was like, walking around just does not sound fun. I was shocked at how manageable the contractions were, standing up and walking around and squatting and all the things. Like laying down or sitting down made them a million times worse.
Such an important point. Movement is golden in labor. We are able to manage our contractions so much better when we are moving around. I love that she was able to just listen to her body and respond to her body and put two and two together and realize that you want to get up, you want to move around to the extent that you can tolerate it. I mean, we want you to rest as well when it's appropriate. We want you to conserve your energy, but walking around, sitting in a chair, being on your birthing ball, using a squat bar, all of these things under the right situations are very appropriate. If we are just monitoring you, you don't have heavy pain medicine on board. Obviously, you don't have your labor epidural. It is appropriate to do all of those things, and we encourage all of those things to help you not only manage pain, but to help labor progress.
I literally had a thought where I was like, oh my gosh, like I could have a natural birth one day. Like I was like, I could do this. Like this is so not easy, but it was manageable. Like every time I felt one coming, I just kind of like squatted through it and was like holding on to Zach, and I was just like, man, I could totally do this. You know, it didn't last, but you know. So we walked around for a couple of hours around the unit. I like did a little dances and stuff because I was like really trying to get that baby out. Then after 2 hours, it was 6:45 in the morning, so I went ahead and went back to the room because she said she'd meet us there in a couple of hours. She was late, but that was the Lord. Like literally, I just felt the Lord all over the 30 minutes that we waited for her in the room. So while we were waiting, I was just like, babe, we need to pray. We need to put worship music on. Like, I do not want to go home if she comes back and checks me and is like, hey, you need to go home. Like, I just don't want that. So we turned worship music on and we're walking around the room, but praying in the spirit, praying over my body, like commanding it to do what it was created to do and to dilate, and like just praying over baby Theo, praying over the nurses, praying over every part of my body that would be part of labor and delivery, like basically commanding it to get ready because we're giving birth, we're not going home.
I love that she didn't forget about her faith. I love that she allowed her faith to ground her in that moment. I love that she allowed her faith to dispel any fear. I love that she invited God into that moment and took charge of her emotions, and that her husband supported her along the way, and they were together in that, and that they allowed the peace that surpasses all understanding that comes with that relationship of understanding who you are and what you have access to as a kid of the kingdom to comfort them, lead, guide, and direct them in that moment. Love it.
So after about 20 minutes of doing that, I ended up getting super nauseous out of nowhere, which throughout the whole pregnancy, I had extreme nausea, vomiting. Like it wasn't anything foreign to me, but this wave came out of nowhere and I was like, oh my gosh, like babe, give me the trash can. I'm about to throw up. So I threw up, and the pressure of like throwing up, it put pressure on my cervix. Like I swear it like pushed the baby down, and I ended up having a bloody show while I was throwing up. Not anything crazy. Like I stood up and there was like a little bit of blood on the table. So I was like, oh my gosh, like I'm bleeding, like I need to go to the bathroom, whatever. And I literally felt the Lord so strong in that moment.
Nausea, vomiting. We see lots of nausea, vomiting in labor. I often tell people, do not eat anything you do not want to see again. I am not opposed to light snacking on labor and delivery under the right circumstances. You know, for someone who is an uncomplicated laboring patient who I do not have a strong clinical suspicion will need a surgical intervention, I often very open to light snacking. But I tell people you really don't want anything heavy on your stomach because there is a whole lot of nausea, vomiting on labor and delivery, because sometimes with those contractions, everything contraction, anything in that stomach is coming right on back up. So that's something to keep in mind. Bloody show is a sign of early labor. So what bloody show is when that cervix is dilating. Those tiny blood vessels on the cervix are super sensitive. So that dilation, that stretch on the cervix is often causing those blood vessels to break, and you see a little bit of bleeding. Now, this is not bleeding like a period. This is not I put on a pad and filled up a pad. If you have that type of bleeding, you need to go to the hospital because that is not normal. This is, I often like to describe it as blood-tinged mucousy discharge that we call the bloody show of labor.
She came back at 7:20 a.m. and she checked me and I was 3 centimeters. And I just knew it was because I threw up. I don't think me walking around really did anything, to be honest. Like, I know it was because of the pressure, because I didn't have a bloody show like while I was walking and squatting. It was when I threw up. So I was very thankful. I'd never been so thankful to throw up. So after she checked me at 7:20, we got checked in finally at 8 a.m. and we ended up getting the last room, which in my head, I'm like, if there's no more rooms left, like, what do they do? Like, do they send you home? Like, I don't understand.
There's a definite number of rooms on labor and delivery. And sometimes what we have to do is understand that there are things that are elective and then there are things that are emergent. So oftentimes, if we are reaching capacity, we will call in backup staff. There typically is always someone in the wing on call, whether it be nursing or physician staffing, to come in and assist when we are busting at the seams. Other times, what we have to do, unfortunately, is delay or cancel elective procedures. So you remember she mentioned being on the elevator with a couple that was coming in for an elective induction. Oftentimes, what we will have to do is maybe send those patients home or call them and let them know, hey, I need you to come in, in 4 hours as opposed to now, because the unit's pretty busy right now. We're at capacity and we don't have the capacity to assist you in your procedure right now. So that is something that we have had to do in the past.
I just felt the Lord over everything. Like, I was so excited. And we ended up getting the last room for postpartum too, which is crazy. And it was the biggest unit with like a beautiful view of the water. Like, that was awesome. So thank you, Lord. So once we got checked in, I laid down and that's when the contractions got really painful. And I realized, oh my gosh, like the reason they weren't that bad before was because I was standing up and like working through them. When you're just sitting there, they're painful. Like, I was literally like gripping the side of the hospital bed, like, oh my gosh, like this is so painful. Luckily, you get like a 5-minute break in between each contraction, but I was just like, oh my gosh, once I'm 10 centimeters, like these are gonna be so close together. And I was planning on getting the epidural anyway, like before I went in. Like, that was literally my birth plan, was epidural. So she asked me if I plan on getting it and I was like, yes. And she's like, okay, cool, I'll just go get the anesthesiologist now and let him know you're next. And I was like, praise the Lord, because I've heard stories of women asking too late or it taking a long time to get it because there's people in front of them. And so when she came back, she was like, you're next on his list, like you're good. I was like, all right, cool. Like, I was very thankful that I just went ahead and was like, sign me up.
So very important that she took the time to have a plan that involved her desire for pain control on labor and delivery. There are lots of things that we can offer you or you can do as a self-intervention for pain control, whether it be that you are laboring the early stages of labor at home or when you arrive on labor and delivery. So we talk about all kinds of different things like movement. We talked about how movement can help manage labor pain, breathing exercises, having a support person with you, whether it's just your birthing partner or a professional like a doula to help you breathe, to help you stay focused, to help do counter pressure on your lower back or your hips in order to help manage some of the labor pain. We often will do things like aromatherapy, massage. I tell patients to don't be afraid to spend time in the bathtub. Hydrotherapy can be very soothing for aches and pains and help you manage those labor contractions. All kinds of things like that can be done. I have patients who put up string lights, affirmations. If they're in the hospital or the birthing center, they can bring something with them that they can focus on from home that maybe is a keepsake from a loved one or just something special to them that will help them stay centered and grounded and focused and help them better manage their pain. I do like to mention other medicinal or medicine options for pain control for patients so that they have time to think through and process which of those things that they are comfortable with. So definitely have that conversation with your provider. Some common choices would be things like IV pain medicine. There are nitrous oxide gases that can also help if you're looking for options that are more conservative, that are not the labor epidural. And then, of course, there's the labor epidural. So definitely a conversation that you need to talk through with your provider ahead of time so that you know what is expected, what to anticipate, and what your wishes and desires are, and put it on your birth plan.
And side note, me and my husband live in Florida without any family here. Like, my family is 4 hours away, his family is 5 hours away. So we had a doula come, but it wasn't so much for like the natural birth reasons of like having a doula there, doing a water birth and stuff, but it really was for support. And this doula is from our church. Like, we view them as spiritual mentors. Like, they are the absolute greatest. And I view them as like spiritual parents, like both her and her husband. So she came and she brought snacks. She brought Zach dinner, which Zach literally almost passed out, and I'm like, babe, like, I'm not even giving birth yet. Why are you faint right now? But I think it's because, like, we jumped out of bed and, you know, came here and he hadn't eaten anything. But she was there, and she put candles around the room. She put, like, fairy lights up, bunch of snacks. She just set the tone and mood of the room, and I just was, like, so thankful to have her there. It's my first baby. Like, we don't have family here, and it literally felt like I had family there for me, and it was incredible. And she was able to answer all of our questions, like when the doctors would offer anything. Like, you really don't know as a first-time mom unless you like doing research, which I kind of did, but ultimately didn't want to get taken advantage of. So we were able to ask Catherine a bunch of questions, and she told us the pros and cons of things. Like, it was incredible having her there.
Think about it. How many hands helped raise you? How many voices spoke life over you? How many arms held you close? Black family is deep, and at Melanin Maternity, we celebrate every single part of it. We're not just a shop for mamas. We're a love letter to the entire village. From keepsake birth announcements that honor your newest blessing, to new dad gifts, to presents for the grandma who still prays over you, we have gifts that tell your family's story. Looking for holiday gear that actually represents us? We got that too. Because whether you're the one having the baby or the one making sure the baby always has love, you deserve to be celebrated. Shop Melanin Maternity on Etsy today by visiting melaninmaternity.etsy.com, because our families, our stories, and our legacies deserve the spotlight.
I love that she had a doula. I encourage doulas for all of my patients. If you don't know, a doula is a non-medical support person that can help support and advocate for you during pregnancy, on labor and delivery, and beyond. They're huge and important for education. They really are able to bridge the gap between your provider and you when it comes to really explaining and breaking down the options and the choices that you have when it comes to your pregnancy, labor and delivery, and postpartum experience. The most important thing, though, that I think that they provide is that support. Just that steady, constant source of guidance and help to ease your mind and really bring you comfort and peace in this situation that can be so anxiety provoking and so fearful and so unknown. I encourage every single patient who is able to access one to get a doula. Doulas improve our pregnancy outcomes 100% hands down. They are 100% essential, and I recommend them. Hopefully we will get to the place one day where they are actually well compensated, and even, where patients can apply insurance towards their services. There are some states that are starting to enact these changes. And I cannot wait until the day comes when we're able to see that globally, because they're so, so important, especially when it comes to Black.
So at 9 a.m., I texted all of my family members that we had gotten checked in at 9 a.m., which I didn't plan on doing because I just didn't want to be like updating a bunch of people throughout the process. So I had a pre-written text already written out, and I just sent it to family members and was like, once he's here, we'll let you know. Because I had no idea what to expect, the labor and delivery, if something went wrong. Like, it would just be a lot to be texting back and forth and trying to give accurate updates. So I just sent a pre-written text. I highly recommend doing that. Just having a text ready to let people know if you want to. You don't have to let people know, but just letting whoever you want know that you're in labor and delivery without having to like come up with a whole text.
Very good tip. Highly recommend.
Okay, I don't know why, but the most painful part to me in this whole experience was the IV. She did the IV on my left arm. She blew my vein, and then she did the IV on my right arm. And I just was dreading the IV. I hate IVs. And the tape on my arm, honestly, the only thing I was thinking about that whole time was taking the tape off. Like, I was so scared. And Zach was like, you're about to give birth. Like, why is this the only thing you're thinking about? And I'm like, the tape. Like, anyway. So that was the most painful part to me, was the IV, but to each their own. I don't know.
That's funny that the most painful part was the IV for her. It's important to know and understand what the requirements are for your birthing facility. Most hospitals do require that you have an IV. And you do want an IV, and this is why. If there is an emergency with what we do, seconds can make the difference between a good outcome and a bad outcome. The very last thing you want, if there is a true emergency, is us poking and prodding and fiddling and trying to find IV access if there really is a true emergency, because that is precious time wasted. You want your nursing team, your support team to be able to swoop in, immediately administer life-saving medications if that is what is needed in the event of a true emergency. Now, some facilities will allow you just to have the IV. You don't necessarily have to have fluids running through the IV if you don't desire to, but most hospitals do require that if you are truly admitted for labor, that you have IV access accessible.
All the nurses, all the midwives were incredible. Like, they were all super sweet. Not that this matters, but they were all in their 20s besides the doctor midwife that was going to be delivering me. But all the nurses were in their 20s and they were like super fun. Like, it just felt like I had a bunch of girlfriends in there and it was really funny. Like, we were making jokes and they were just super sweet.
I love that she was comfortable with her nursing staff. This is so important. It's such an important piece of the puzzle to be just feeling like you are among friends, feeling like you can express yourself, that you can talk openly and freely with people who truly see and get you and understand you. That is truly a blessing. So I love that she brought that up. I want people to understand that you are deserving of respect. You are deserving of care that is equitable, care that is respectful. You are deserving of being treated and talked to like you matter. And so if you find yourself under the care of a person, a nurse, a tech, a support person, or whomever, and you feel that you are getting less than the care you deserve, speak up and say something. Use your voice. If you feel that you need your care team to be changed, ask and make that request because they can accommodate your request. You do not have to put up with mistreatment. You do not. You do not. You can demand better. You can request that you're treated decently. So I love that she was comfortable with her care team and she took the moment to express that because that is important. That made all the difference, just like she said, in her labor and delivery experience.
So before the epidural arrived, she said that I had to be on fluids for 30 minutes and that the fluids could potentially slow down my contractions. So she hooked up I don't know if it was like water, probably, but like she hooked that up to my IV and that did indeed slow down my contractions. So the midwife, which is the main doctor, I'm just gonna call her doctor, she came in and she was like, hey, your contractions aren't looking close together. Like, we need you to be able to breast. Like, we may need to put you on Pitocin, which I really did not want Pitocin because I've heard so many horror stories about Pitocin contractions and how they're unbearable. But at this point, I knew I was getting the epidural and I was like, I might as well just get Pitocin to speed things up.
I want to hear from you. Tell me out there your experience. Pitocin contractions versus natural spontaneous labor contractions. Is it true that they're more painful? Yes or no? What was your personal experience? This is what I think. Contractions are contractions. They are painful regardless. Contractions are contractions. It don't matter if they're spontaneous or induced. Contractions are painful. But I want to hear from you. Tell me your opinion. If you've had this experience, contractions with or without Pitocin, which were more painful? What was your experience? Let me know in the comments below.
The epidural, oh my gosh, thank the Lord, whoever created that incredible invention. Now, I know a lot of women have had awful experiences with the epidural, so I'm not giving this blanket statement of like, oh my gosh, epidural, but I mean, yeah. So the guy, the anesthesiologist, Steven, he was the bomb. He came in and he was so funny. Like, he was making jokes with me and he was like sarcastic, but like in a good way, you know, like not too much. He was just like, okay, are you ready? Like, we're gonna do the epidural now. And I was like, can you count down? Like, I'm really nervous. And he was like, okay, I mean, yeah, I guess we can count down. Like, he was just kidding, but he was making the experience less scary because I just heard so many things about it. And so I didn't even feel anything. And it was not because the contractions were so strong, like I didn't feel anything. No, I literally felt nothing, which I've never been afraid of needles or shots or anything. So maybe that's why, but they do have you like bend over and do the whole thing. And I was like, okay, like do this. And then he was like, okay, we're done. And I was like, that's it? Like, you did it? And he was like, yeah. It was so funny. So I am just so thankful that the anesthesiologist was cool, funny, making my experience a lot better. I've heard awful stories.
I love that she brought up the interaction with her anesthesiologist. I think as healthcare providers, it's so important that, you know, it may be your 11th time to do this tonight or this year or this month or in your career or whatever the case may be, but it's the patient's first time. And she deserves all the care and the time and the attention that is necessary to get her through that experience. So keep that in mind. Keep that in mind that they deserve the best of you and that you have to set aside whatever it is and get that patient safely through that experience with all of the care and the attention and the time that is necessary to ease their mind while being there. That is also your responsibility, not just the technical bits and details of the procedure that you're doing, but to really see the patient that's in front of you, see that person, see their fears, see their anxieties, see their worries, and speak to and address the humanity in that person, not just the checks and the balances of the steps of the procedure. I'm so glad you mentioned that.
And the best part, I didn't know you could get different dosages of the epidural. So he started me at the lowest one, and I was able to still move and feel my legs. That was one thing I was like kind of nervous about, was not being able to move my legs or like feel my whole lower body. I felt literally my legs, I can move them. I couldn't stand, but I could feel my legs, and I was just so thankful. When the epidural went in, my whole lower body went warm, but it wasn't like numb. So that was cool. Even when I gave birth, like I could still feel him coming out, but it wasn't painful.
Very important point. The epidural can definitely be titrated. What that means is you can get more or less medicine depending on your needs for that specific situation. My preference is for you not to be completely numb. Like, I want you to feel a little bit of pressure. I don't want you to be uncomfortable. I don't want you to feel pain. But in most cases, you still want to feel touch and pressure, because if you feel nothing, especially as a first-time mom, it's really hard to like conceptually, intellectually understand how to push if you've never done it before and you don't have that pressure as a guide. So you actually want to feel a little bit of pressure because it's a helpful guide and can make your pushing more efficient.
One thing he did warn me about was you could get nauseous with the epidural. So I ended up throwing up like right after the epidural was put in. But weirdly enough, like I couldn't feel anything. Like it kind of just felt like something, this is TMI, you're watching this, but it kind of just felt like something coming out of my mouth. And I think it was because I couldn't feel like the pressure on my stomach because of the epidural. So it was like the most peaceful vomiting ever. It sounds weird. And especially after 9 months of throwing up constantly, like I was just kind of like, it kind of just came out and then it was done and I was like, okay, I'm fine. You know, like it was just, I can't explain it. But I did throw up after getting the epidural multiple times.
I actually see this pretty commonly, nausea, vomiting, we talked about it, pretty common on labor and delivery, but sometimes the reason you have a lot of nausea, vomiting after the epidural is because it drops your blood pressure. And so you'll often see that the anesthesia staff will have to come back in and give medicines to bring your blood pressure back up. That's also why they try to pre-medicate you by giving you a bolus of fluid or a bag of fluid through your IV to support your blood pressures, because that sudden drop in blood pressure when the epidural goes in can definitely make you nauseated. And sometimes you'll actually see the baby's heart rate respond to that as well. And so that's what she's speaking to here.
And another thing that I did not know is that you cannot eat with the epidural. You can only be on a clear liquid diet. So they came in and brought me water, little ice chips, and they brought me like this clear soup. It was disgusting. I literally, as soon as I ate it, I threw it up. It was so gross. At that point, I hadn't slept in probably over 24 hours. So I was able to take a nap after getting the epidural. My body was so relaxed. And they actually had a peanut ball there, which was awesome. So I just took a nap with a peanut ball. I just put my leg over the top, took a nap.
Clear liquid diet is jellos, juices, soup broths, popsicles, water, ice chips. Very common and probably the most common diet that we use on labor and delivery. I love the peanut ball. I love the peanut ball. It's a ball, guys, like a birthing ball, literally shaped like a peanut. And we often put it between your legs with the labor epidural because it keeps your pelvis open and it helps your pelvis stay in a position that allows it to be open. And we feel like it allows labor to progress more efficiently because that pelvis is open and baby's able to navigate through the pelvis more efficiently. So love the peanut ball with the labor epidural.
I was just super relaxed, and I'm like, it was just weird, like thinking, oh my gosh, I'm about to have a baby like today. It was crazy. So at 2:45, I was 5 centimeters dilated. My water hadn't broken yet, so they went ahead and broke it to speed things up. And then I took another nap with a peanut ball. So after that nap, which was like an hour later, she came back and she was like, we can't track the baby's heartbeat because of the positions you're laying in. So we want to do internal monitoring, which I don't know why, but something in me kind of like freaked out when she said that. I just didn't want more tubes and cords and things attached to me. So I was like, okay, can we think about it? Like, what are the pros and cons? Which is really just monitoring his heartbeat internally, like up there. But I, for some reason, just like didn't want to do that. So they left the room and we kind of like talked things out with the doula and Zach. And I was just like, I don't know why, but something in me just doesn't feel like I want to do that.
Okay, I look crazy because I'm editing this, but literally I saw something on Facebook about internal monitoring on like the baby. It leaves a mark on their head. It literally like clips into their head while they're in you, leaves a mark in their head. And a bunch of comments were like, my baby still has a mark to this day and they're 8 years old. They have a bald spot. Like, I didn't even look it up. I just had a feeling in my gut to not do that. So yeah, I'm happy I didn't do that.
She was concerned because she was like, we're not able to track his heartbeat or your contractions because the monitors were not like staying on my stomach. And so she was like, that being said, we don't want to give you more Pitocin to speed things up because we can't keep track of his heartbeat, which I don't know if she was wanting to give me Pitocin to like speed things up for her. I don't really know.
Love this discussion. So she is literally spelling out informed consent, right? Someone's recommending something to you. What are the, use your brain format? What are the benefits? What are the risks? What are the alternatives? What are the indications? What is my intuition saying to me? What happens if I do nothing? And then make sure that your questions and concerns are addressed appropriately. After you go through that process and you understand all of those components, you as the patient have a right to make an informed decision for or against whatever is being recommended to you, because you understand exactly what is involved in the decision-making process. That is shared decision-making to the T. And with every decision that is being presented to you, you should go through that framework each and every time. Now, I have been doing this for 18 years, and there has not been one time that I have seen a baby have a permanent scar on their head or have an area where their hair does not grow from an internal monitor. When I recommend internal monitors, it is because I am having difficulty keeping track of the baby or understanding the true contraction pattern, and to decide whether or not things are progressing as they should or a baby is showing signs and symptoms of distress. So there are two internal monitors. One is an intrauterine pressure catheter. It goes in the bag of water beside the baby, and it literally is a more accurate look at when your contractions are happening and how strong they are. And then the other one is a fetal scalp electrode that goes on top of baby's head, and it's a much more accurate view of the heart rate tracing, which is kind of like a vital sign. Think of it as like a blood pressure or a temperature. We don't have that type of access to the baby like we have to mama. So this is our way of understanding how is baby managing the stress of labor, because labor is stressful for them, not just for you. It's stressful for them too. And so this allows us to identify a stressor, and if it's a significant concern, intervene to help hopefully improve our outcomes.
She ended up saying like, but let me just check you and see where you're at. So they checked me. It was the doctor in the room and like two other midwives or two other nurses. Her jaw drops and she looks at the two nurses next to her and she's like, she's at a 9.5. A 9.5. Like literally everybody in the room was like, what? Like, are you serious? And I looked at everyone and I was like, you're kidding. I literally was like, you guys are kidding. So the doula is laughing, like all the nurses are laughing because we did not expect me to be at a 9.5. I don't know what did it. I don't know if it was breaking my water. I don't know if it was me taking the nap with the peanut balls, but they were like, yeah, you're like about ready to push in like 30 minutes. So I was just like, okay, cool. And at this point I was still so relaxed and I was like, this is crazy. Like movies make birth look so scary and I was waiting for that to happen to me kind of, but it was just the most relaxing experience. Like if I knew it was gonna be like that for every single baby, I would give birth so many more times. Like it was just funny.
This point she brings up about relaxation, I often get pushback from patients in terms of, well, I don't know that I want to get an epidural this early because I've heard that it slows down the labor process. But in my experience, I often experience the exact opposite. I really feel like, when we are hurting, as a reflex defense, we contract and bear down all of our muscles in a means to protect ourselves. And when we do that, our body is so tight and so tense that it actually, I think, slows down the labor progression and the labor process because we're not open. When you get that labor epidural, rather than it slowing things down, I actually see the exact opposite, which is that things speed up incredibly because you are now so open and so relaxed. Every muscle of your body is just in that state that just allows things to blossom and open and progress way more efficiently than it ever did prior to the labor epidural. So keep that in mind.
So I went ahead and took another nap for like 30 to 45 minutes. And when I woke up, the nurse looked at me and she was like, well, you're ready to push, like if you want to push. And I was like, okay. Like, it was just weird. Like, I looked at Zach and I was like, this is it. Like, I'm about to give birth. And he's like, yeah. He was more nervous than me. It was so funny. Like, I feel like I kept having to like comfort him, like, babe, this is so fun. But I think like I was on the medicine, so I was super loopy, kind of like, ooh, this is so much fun. Not loopy, like I was still aware, but I was just super calm and relaxed. So now it's time for the delivery part. So with the contractions, I could feel my belly like get hard, but it wasn't painful. It just felt like pressure. Little man's starting to wake up. I might have to go get him. Let me go get him.
Hello. Good morning.
He's probably hungry.
Hey, hello. My little baby.
Okay, I'm just feeding him, so sorry if you hear gulps and noises. It's just
You're eating. Yeah.
so I could feel my stomach get hard, but there wasn't any pain. That being said, you do have to push with your contractions when you're giving birth. So they were able to tell me when to push, but I honestly would feel my stomach starting the contractions. So I was like, is it time to push? And they like looked at the monitor and they're like, yep, it's time to push. So I pushed for an hour. It felt like forever. I feel like that's still forever, but they were like, wow, that was so fast. Like, good job. You did great. First time moms usually take forever. That felt like forever to me. And in my head, I still feel like an hour is a long time.
First time moms can push anywhere from 20 minutes to 3 hours. Don't be a 3-hour pusher. But it's not unusual to push, a good hour for sure. And, the first 20 to 30 minutes is really just you figuring out what it is that you're supposed to be doing. And once you get the hang of figuring it out, it's just going through the motions of getting it done. But it is not unusual for most first-time moms to push up to 3 hours. Now, that's the first experience. It likely will never be like that again. Your body, after that first experience, has that built-in memory. It's like riding a bike. It just comes to you, and it will never be like that again. So praise God for that.
And on that last push, they all were like, okay, this is the last push. You can do this.
I'm sorry. Am I being too loud?
And they were like, okay, this is the last push. You can do this. And I remember looking at Zach standing right next to me, above me, and I'm like, is this the last one? Is this the last one? Because at that point, it just felt so surreal. Like, I was like, this is it. Like, we're about to have a baby. And then baby Theo was born. He was 7 pounds, 3 ounces, 21 inches long. I never thought I'd be like one of those parents who remembered the birth weight and everything, but I think it's just something you remember for the rest of your life. And I was just like, oh, it was crazy feeling him come out. Like, I could feel him come out. Even with the epidural, I felt his head, I felt his shoulders, his legs, and it was just the craziest feeling ever. When he came out, all the nurses were like, open your eyes, because I was closing them because I was pushing, and I just opened my eyes and he was there looking at me. Like, they put him on my chest and he had the biggest cone head ever, but it was like, they're like, that'll go to normal after, and I'm like, okay. And it was just the most incredible experience ever. Like, would totally do again. It just felt like this is what my body was made to do. Like, it was just crazy.
Yeah.
And that's the story of how you got here.
Thank you so much for joining us on today's episode. Be sure and join us again next week. Take good care.
Want to go deeper? The conversation doesn't have to stop here. Join Melanin Maternity, our digital Black birth community, where you'll get expert guidance, real support, and a sisterhood that sees you. From live Q&As with birth experts to empowering discussions with other Black mamas, we've got you covered. Click the link in the description and step into the community you deserve.